Arkansas is for explorers, seekers, and trailblazers. It's for those who like to travel a different path, or maybe even create one of their own. It's where people and places come together to create extraordinary possibilities. Come experience it for yourself. Hike to a swimming hole, get on some single track, hop in a kayak, or just pack a bag and see where the road takes you. Adventure is everywhere you look in Arkansas. Plan yours at arkansas.com.
Hey, welcome back into the Windsor Report, Wednesday edition, June 18th, 2025. Quick shout out to Americans for Prosperity Ohio and their Buckeye Blueprint. Check it out at buckeyeblueprint.com. That's AFP Ohio's initiative for a bolder, better Buckeye state, moving us from middle of the Midwest to number one in America. Thank you, AFP Ohio, for your foundational support of the Windsor Report. Joining us is Will Hild, Executive Director of Consumers Research. His new report, Woke Hospitals, Embracing Political Priorities Ahead of Patient Care, targets 5 hospital systems: Cleveland Clinic, Vanderbilt University Medical, Henry Ford Health, Memorial Hermann, and Johns Hopkins All Children's for allegedly misusing taxpayer funds to promote DEI, climate activism, and then, of course, controversial gender ideology over patient care. Will, welcome back to the Windsor Report. How's your Wednesday, man?
It's great, man. Great to be back with you.
Thank you for carving out time. This is an important report, and I don't want to fly over any of it. So I want to give you a chance to outline what this latest report is, what it reveals about these 5 hospital systems, and really, I think the crux of it is why it's critical for consumers to understand and hear these issues.
Yeah, absolutely. Well, what attracted us to this issue was the fact that we found, we've got all these hospitals that are 501c3 nonprofits. They receive tax benefits. They don't have to pay basically any federal taxes whatsoever. They receive oftentimes millions, if not billions, in federal research grants, and sometimes grants to help provide health care to low-income individuals. And, of course, they get grants at the state level in many of the states where they exist. So these are subsidized entities, soup to nuts, at pretty much every level, whether it's tax or federal funding, state funding. And yet when you looked into what their activities actually were, they're pushing a far-left progressive agenda that has nothing to do with providing patient care. And in case, as you mentioned, we'll get to this, but as you mentioned, when it comes to providing so-called gender-affirming care, or what I call child genital mutilation, they're actively harming children. So with our tax money. So we wanted to highlight for consumers in these nationwide, but certainly in the states where these medical systems reside, how problematic their activities are and how deep it goes. So real quick, one of the things we've seen is that, a lot of companies have been pushing DEI with their hiring and their promotion, and that's bad. That's a violation of federal law. Yeah. But what's really incredible about some of these healthcare systems, like the Cleveland Clinic, for example, in Ohio, is that they were actually pushing DEI down to the very ways that they were treating their patients. Cleveland Clinic had a program that was just for minority individuals. There was a stroke program and then a men's health program that were specifically for people of non-white or minority status. So they're not only just engaging in DEI with their hiring and promotion, they're engaging in DEI when it comes to the way they treat patients. Additionally, I'll note, this is probably the least of the problems that we're going to deal with today, but I do think it matters because it increased costs. You have a ton of these hospitals, including Cleveland Clinic, pushing tons of money to green boondoggles to chase so-called net zero targets. Net zero targets are impossible. They're a myth. All they do is increase costs for customers because eventually those costs have to be pushed on to patients and included in the cost, or you pay for them into your tax dollars, federal money and state money that just goes to building wind farms and solar panels instead of treating patient care. But then last but certainly not least, these hospitals, many of them, have been engaging in the genital mutilation of children, Cleveland Clinic included, who did over 100 procedures related to, quote-unquote, gender reassignment, including genital mutilation like mastectomies, removal of the breast tissue, or penectomies, even removal of completely healthy genitalia on children. And so we think it's high time that elected officials at the federal and state level look into this. We're glad to see that the Trump administration has talked vociferously about taking this type of issue on seriously, and we're hoping that at the state level, the governors of these states, Ohio, Tennessee, Michigan, Texas, and Florida, will take these issues seriously and clean these hospital systems up, because they're taking our tax dollars and they're mistreating our country's children, and misusing the tax dollars. So that's a long-winded, but that kind of gives you the full lay of the land.
No, that's exceptional. And I'm going to ask a question that probably seems like, well, why are you asking this? But I know I can be obtuse or hard-headed sometimes, or I can miss, the forest through the trees. But let's talk about the Cleveland Clinic. A couple of facts here. They generated $16 billion with a B in 2024. Their CEO, Tom Mihaljevic, or maybe it's pronounced Mihalovic, but I'm going to say Mihaljevic, earned over $7 million. And he says that healthcare is only part of their mission, which is so crazy to me. So I want you to really lay this out. I think you have already, but I really want you to get granular. When they focus on DEI or climate activism, or as you mentioned, 100 plus cases of gender mutilation, or the hormone therapy, which crams into kids' bodies hormones that their bodies are not hardwired to accept and operate with. How does that undermine patient care?
Well, that is a great question, because even if you didn't care about all these things, even let's say you're a left-wing person listening to this show and you agree with some of the aims maybe that they're undertaking, when you have any organization that starts moving away from its core mission in order to chase these other things that are not related to patient care suffers. Consumers Research, we have been on this issue of ESG and woke capitalism now for about 5 years since I came on to lead the organization. It's been our major focus. And I can tell you with absolute metaphysical certainty that companies, when they start focusing on serving woke activism and woke politicians, their products suffer, their services suffer. Mm-hmm. So even if if it is pure selfishness, you only care about yourself and the treatment you're going to get, when you have any organization, but specifically hospitals, that are taken over by ideological, woke mind viruses, as Elon calls them, mind parasites, where they focus on these, racial and sexual preferences in the hiring and promotion or treatment of patients, when they focus on mutilating children and all that entails, and when they focus on how they can spend our tax dollar money and your patient dollars on green boondoggles, when they're focusing on that, they're not focusing on you as a patient. And there's just only so much bandwidth that any organization has, brain power-wise, bureaucracy-wise, and when they're focusing on these other things, patient care suffers. And so these are some of the best places, and that's one of the pushbacks I get. The list we're mentioning, these are some of the most prestigious names in healthcare, and that's certainly the case. They've done incredible things. We want to continue to see them do incredible things. As we saw with COVID, and a lot of what that entailed, and some of the corruption that happened inside the medical industry there. No matter how prestigious an organization is, if it starts focusing on corrupt purposes, the results suffer, and that's where we stand today with these organizations.
Well, I only have about a minute and a half here before we have to pay the bills and take a break. Can you stick with me for another segment?
Yes, certainly.
Okay, so we're talking about, and you said something there, and I need to highlight this. We're talking about, in this report, embracing political priorities ahead of patient care. Cleveland Clinic, Vanderbilt University Medical, Henry Ford Health, Memorial Hermann, Johns Hopkins, All Children's. And I'm going to ask this question. It's going to take me a minute to get it around the barn. You might just answer with tip of the iceberg answer, and then when we come back, you can fully dive in. But you said something. You said these are renowned hospitals. These are places that have won awards. They're held up as like creme de la creme. They are the best of the best. Well, that's what scares me, is that we have hospitals who are either willfully practicing negligently or they've been duped. And in Ohio, for example, we have a governor who at one point vetoed House Bill 68, which was the SAFE Act, that stopped kids from taking puberty blockers, cross-sex hormones, and having their body parts mutilated. So I guess that, to me, is the concern. And I'll tee it up this way. Michael Schellenberger, he exposed in the release of the WPATH files doubts among medical professionals about the safety of gender-affirming care for minors. Basically, doctors behind closed doors saying, this is not working. How do hospitals like Vanderbilt or Henry Ford or Cleveland Clinic which your report says performed dozens of sex change procedures on minors. How did they get duped? So we've only got 15 seconds here. I'm just going to tee that question up. I'm going to let it percolate in your mind. How in the world did we get here? If these are the best hospitals, we have WPATH files at the other end of the break here. We'll talk about Cheryl Atkinson's reporting on the pseudoscience and medical malpractice. Stay tuned. Will's going to answer this really long, drawn-out question next on the Windsor Report.
There are so many fun